adrenals. So this is a small gland, but it is of prime significance importance to the surgeon. So before getting into the pathology, let's discuss something in short about the surgical anatomy of adrenal glands. So adrenal usually weighs approximately around 4 gram. It is divided into two parts. The outer part, which is called the cortex, and the inner part, which is the medulla. An important question asked in respect to this is the development of cortex and medulla. The cortex is mesodermal and in origin, and medulla is neuroectodermal in origin. The cortex is consists of three parts. The first is the zona glomerulosa. Now, this consists of small and compact cells. It secretes aldosterone. Then, the next part is the zona fasciculata. This consists of large lipoid rich cells which are arranged in radial column. Large rich lipoid cells arranged in radial column. It secretes cortisol. Then the next layer is the zona reticularis. Now, this consists of the compact pigmented cells. Now, it secretes the adrenal androgen dehydroepiandrosterone. So, next important question that is asked regarding the adrenal is regarding the location of adrenal gland. It is situated at the upper pole of kidney within the gyrus fascia in the retroperitoneum. Upper pole of the kidney within the gyrus fascia in the retroperitoneum. So on the right side, it is usually between the right lobe of the liver and the diaphragm and behind the IVC. Between the right lobe of liver and diaphragm and behind IVC, whereas on the left side it is covered by tail of pancreas and spleen. This is of importance because in case of left-sided adrenal operation, there are chances of injury to the pancreatic tail and spleen. Next important concept in adrenal anatomy is regarding the blood supply. There are numerous arteries supply to the adrenal, which are branches from the aorta, branches from the diaphragmatic, and branches from the renal artery. The most important significance in blood supply of the adrenal gland is with respect to the vein supply. It is supplied, the venous drainage is by right adrenal vein, which drains into IVC. Now this is a small and stout vein, as a result of which high chances of injury during operation. It is approximately said to be around 1.25 centimeter. So any injury would be very difficult to control as it as such drains into the inferior vena cava. The left adrenal vein drains into left sided renal vein. An important characteristic of this vein is that it is concentric in shape. So in case of a kidney injury or an adrenal gland injury, the venous injury is one of the most dreaded complications by the surgeon. Now, ending the surgical anatomy part of this, I would say that embryological development of kidney and adrenal is different. So what happens is that in case of renal oogenesis, the adrenal gland still lies in normal position. Now next we would be discussing the various pathologies with respect to